I want to hear how the interpretation of what's going on from Rusty Trombone here. Why COVID is no problem anymore or something. Now there might be an ad. Yes, there is. All right.
If you're trying to lose belly fat, stop doing cardio.
Boris Johnson, the British Prime Minister, has announced that all COVID restrictions are now over and the Biden administration are no longer publishing daily coronavirus figures. Does this mean that coronavirus is no longer an issue, or does it mean that coronavirus is being mobilized and utilized for political expediency?
Yes, now they're controlling you by not controlling you. Eh? Ah, they're so clever. What they're going to do is like let you go back to normal so that you think, oh, normal's great, innit?
Perhaps has been previously.
By the way, that's his, I don't know, you know, who can say? I'm not saying anything. I'm just inferring the shit out of it. I'm implying everything and inferring and acting like I'm just being quizzical. I'm just asking questions.
There you 4.7 million awakening wonders resisting the constant restrictions and regulations and attempts to turn you into a conditioned citizen, remaining responsible, compassionate and fair, listening to other people, remaining open-hearted.
Oh, for fuck's sake. Like, fighting the system while not being rude. Resisting the structures. You're not going out without a mask, asshole. He wears a mask everywhere he goes. I don't know for sure if he's vaccinated. I wouldn't doubt it. I'm guessing so because he wants to do shows. Fighting the system, yeah? I'll know from my nice country house. It only cost me, 1.8 million quid or something.
And brave, that's how I think of you. By God, I hope it's how you think of me. What?
No. I think you're manipulating the emotionally and psychologically gullible anti-system crowd for monetary gain. I don't think you buy it for a fucking second, and I think it's all about ego. That's what I think of you, for the record.
Going on in the world, in the UK, where I live and am indeed from, coronavirus restrictions are mostly being eliminated now and ultimately removed within a few weeks. Biden's administration over in America is now not publishing coronavirus figures. For what reason? Why?
Yeah, why? What could they? I don't know. Is that a fact? Is it something they're doing? Let's see. I'm on the wrong keyboard. Hold on. What am I? Let's see. No, that's not the. No, it was something different. Hold on one second. Yeah, I don't. Okay, this is the closest thing I can find to what he's asserting right off the bat. Former Biden advisors urge a pandemic strategy for the new normal. On the day President Biden was inaugurated, the advisory president council transition officially ceased to exist. But its members have quietly continued to meet regularly over Zoom. The conversations, and now 6 of those former advisors have gone public with an extraordinary, albeit polite, critique and a plea to be heard. Adopt new normal of living out there. Those are all big names in American medicine. Like any White House, Biden's prizes loyalty and prefers to keep its differences in house. In that regard, the usual misstep from a macro perspective feels like we're always fighting yesterday's crisis. Authors shared articles White House before they were published. It was unclear whether the administration would adopt any of the suggestions. Zagatha is going around accepting COVID, even though several recent media accounts suggest the administration meeting operate. It's coming around to accepting that COVID is here to stay, even though several recent media accounts suggest that the administration has been beginning to operate on that assumption. Mr. Biden's recent emphasis on keeping schools open, business running, even when cases are soaring, also suggests a recalibration, as does a recent decision by the CDC and Center for Disease Control and Prevention to recommend people isolate for 5 days instead of 10. Outlining ideas. Now, I don't know where this whole, like, they're not publishing details anymore, which is fucking what? All right. But maybe he'll show an article.
Was the point of it in the first place? So many questions come from that. And
yeah, it's totally, the only reason wasn't to save lives or to react to a pandemic that was crawling across the earth, killing Italians and people in the UK and people in China, and they were building fucking prisons and throwing people in them and all that shit. It wasn't because of that. It wasn't a reaction to that. It was like, oh, good, look, a disease. We can put a leash around all of our citizens, finally. I gotta say, this whole, like, it's just about government control bullshit is so cartoonishly childish. It's like a 12-year-old standing in the door of the house. There's a hurricane outside, and you're like, you're just telling me it's raining so I won't go outside. And you're like, no, I'm showing you that it's raining so you won't go outside. This is just about control.
Is basically a prison colony again. So what's happening around coronavirus? Is it being utilized for political gain? Has it?
Yeah. Yes. Is it? Is it now? Is it? Yes. Apparently the Republicans in the country that I'm in are using it to kill off the more virulent maggot strain in their ranks by getting vaccinated themselves, but going on the news and saying, nah, don't do that stuff. It's terrible. You're not the
always been utilized for political gain. Is there a symbolic component to coronavirus when all the while we've been told it's about science? Now, of course, as you know, this remains an incredibly sensitive issue. There's no doubt that...
Why? Why would it be sensitive? Why?
Many people's lives have been hugely impacted medically, politically, socially, psychologically.
Yeah, just generally. You know what I mean? It's been impacted by it. What a fucking flaccid... like, have your cake and smear it on your wife's face too. Non-answer. Impacted. Yeah, I would say that the dead and their families in particular. How about people who needed lung transplants, fucko? I think they've been impacted.
I don't claim to be an expert in anything other than my own...
Other than your own what? Hold on. Oh, this is Rumble. I can't jump back. Son of a bitch.
Own thoughts, and most of the time I'm guessing what they are. So let's have a look at these news stories and see together whether we believe that it means the narrative is crumbling, COVID is being used symbolically.
Jesus Christ, dude. Don't tell us what to think about these things before you show them or anything. Now, I'm going to read these things to you, and remember, I've selectively picked these articles so that you'll think that there was a narrative in the first place, and it's falling apart, and it was never real in the first place, because it's about fucking mind control, and, fuck off. Jesus Christ.
And politically, and also, what I think isn't that bloody important, is it actually? What you think is important, and I want to know in the comments below.
Fucking, this is run-of-the-mill YouTube Academy subscriber, like, how to build your content and get more people engaged.
Worried about these regulations changing? What are your feelings about the utility of coronavirus and the pandemic?
Yes, your feelings about it. Don't use your brain, use your emotions, because that's easy for me to manipulate and control and milk. Because basically you're a sow, and I'm just dragging on your tits right now. That's what I'll do. I'll pay for this big, beautiful house by milking your anxiety like fucking utters.
Subsequent regulation. All of this, you can let me know what you feel below, and it's better for me if you subscribe as well, so consider doing that.
Yeah, because you got to show Big Tech Who's boss by subscribing.
Already. Now let's see what's in the news with these famous bits of paper of mine. You're right, old woodshed. Boris Johnson has announced the end of all...
Oh, someone's getting sensitive about people calling out his bullshit woodpile. Wonder why that is. Boris Johnson has announced the end of all COVID measures introduced to combat the fucking hell, man. So we're just gonna skip past the second part, the second half of that whole fucking sentence, because they'd already lifted them before and they reinstituted them just for Omicron. They're like, oh, it won't be necessary, so they went back to it. So this isn't all new. This post Delta, they tried this, they popped it back on for Omicron, then they turned out it's less dangerous, it's easier to spread, but they feel like it's manageable and they have enough treatments and enough of a vaccine wall to stop it from being, gacking up the National Health Service or whatever. But who thinks he's going to blow off that whole introduced to combat the Omicron variant part, like the recent part of it, and make this like all the shit for like the last 2 years? Fucking hell.
COVID measures introduced to combat the Omicron variant, compulsory mask wearing on public transport and in shops, guidance to work from home, and vaccine certificates from next week. What I suppose is fascinating about that is that many people will welcome the relief. I think a lot of people feel
yeah, but that's how they get you, isn't it? That's how they lure you in, right? You're like, oh, freedom. And then it turns out it's a worm with a hook in it. Oh, yeah. That's how oh, man. But you think, fucking hell.
Around coronavirus and a frustration, and people want to just get on with their lives. I know a lot of people think, and in fact I think Saeed Javid said, like, this is going to be something that we have to live with, but there will be other people that feel deeply concerned, and there will be legitimacy to those concerns. Perhaps you're a health worker who's been hit up by it, although I know there's a variety of opinions in that particular sector, and certainly it seems there's a great deal of social tension.
Nobody really thinks about it, it's there's a lot of different feelings, a lot of vibes. There's like 35 healthcare workers who are lunatic, QAnon people who don't believe in vaccines. And then there's like everybody else.
Social tension anyway, and perhaps coronavirus and the differing opinions and views around it have led to an increase in social tension, social conflict, and
yeah, I don't know who'd be driving that shit up by saying that it's all part of a big scheme to control your fucking mind. Ooh, I don't even know how that occurred to me, you know what I mean? Like, I thought they were dividing us, but then I realized, fucking hell. We're being torn apart, by, on one side, people going, it's a fucking disease, get a vaccine, we've got one, it's okay, you're gonna be fine. Normal. This is not weird. We do this. It's 2021 and we've got a vaccine because it's not 1921, fucko. Just take it so we can all get back to normal. And then on the other side, it's fucking mind control, yeah? And you've got to think for yourselves. And I'm not telling you how to think, but I'm pointing at certain parts and winking the whole fucking time, woodpile. Fuck off.
General disease, as well as the impacts of the condition itself. To cheers from some on the Conservative benches, Johnson announced an immediate end to the need for pupils to wear masks at secondary schools. Now, this is significant, of course, because those of you that follow the news, and I hope that's all of you, although you might think it's propaganda and don't bother watching it, will know that Boris...
Yeah, don't ever let a sentence go by without saying the exact opposite just to cover your ass. I mean, everyone's welcome. I'll span the entire gamut of political thought, from people who want to, QAnon believers who want to burn down the government because they think it's run by a cabal of pedophiles that drink baby milkshakes, to anarchists who don't believe that any society should exist and that sexual incels should have the right to have sex with any woman they want, and just forcibly, because they it's sort of like sexual communism. They need to be free, yeah? You got to each according to his needs. That whole gamut, like both of those people should feel completely welcome listening to my bullshit.
is experiencing a significant political crisis because of the revelation that he can barely go half hour without having some sort of party, an excessive amount of party, like it's some frat house instead of an actual.
He went to a garden party in like one of their government compound areas for 25 minutes. I don't even like the fucking dude. Why do I have to defend him from your bullshit?
Of government parties literally every day, some really mental stuff, people breaking swings, bring your own booze, stuff that I don't think would be acceptable under any conditions, and it brings about a lot of questions. Boris Johnson,
yeah, unless you're Russell 10 years ago
have coronavirus. Why are they not concerned about the spread of coronavirus among themselves and their impact among themselves?
And they took what they were feeling. They get the information first. Fucking hell, I'm gonna stupid. They get the information first, and then they make a decision about doing it. And then in that 2-week period where they're like, all right, it seems like the reports from South Africa, from the United States, from the UK, from Italy, other places, that Omicron's not going to, we're not going to have to batten down the hatches for this one. We can start thinking about opening up. And during that week of them getting that information before they disseminate it to the public to make sure that it's true, before they go, it's fine, and everybody runs out and gets fucking dead, he goes to a party in the building, and it becomes a big to-do because... I don't know, like fucking first world beta problems, and then they go, yeah, well, we went to the party, but we're gonna do that for everybody now. It turns out it's okay. Like, God.
Questions around that, and of course, importantly, the hypocrisy of implementing rules that you're not prepared to obey.
Most of the people that were at that party work together all the fucking time. They walk around in the building together, they eat without masks on, and then they put their masks back on and all this kind of stuff, but they barely leave. They're all interacting with the same fucking people. It wasn't like they went to, I don't know, have a rally in the middle of fucking Florence, Arizona.
And something as significant as this obviously will alter the narrative. And this idea that coronavirus has a narrative impact as well as a practical, medical and regulatory one is something that we're examining.
No, it's not something that you're examining. It's something you're a fucking part of. Russell is a direct interferer in the narrative. And in the worst kind of a way, too. Because there's one thing to have, like, a total anti-vaxxer lunatic where you're like, okay, I can weigh that against the other shit that they're doing, right? And go, all right, this person also believes that JFK Jr. is going to, play with the Rolling Stones tonight and become Trump's running mate. So I can kind of, even though they're all in on this stupidity, I can balance it and go, oh, do I take it seriously? I don't know. I'll let you know after the Stones play. And then, on the one hand, like there's that extreme, and then there's the other, side of the spectrum, which is the boring normalcy of medical science and the public trying to keep up with an actual pandemic that is actually occurring and is making its way across the globe and has a lot of moving variables in it. That if you lock too hard on one of them, you might be wrong for a few weeks afterwards. But you might be doing it out of a genuine sense of concern. And in the middle, fucking up the whole decision-making process between reality and lunacy is Russell going, I don't know, is 6 1/2 dozen of another. You know what I mean? Should be able to do whatever you want. Go out without a mask on, don't get vaccinated, but at the same time, don't cough on anyone. Just breathe. Like, it's fucking stupid.
Statement will please a number of his backbenchers. It prompted concern from teaching and health unions and from NHS and public health representatives.
Yes, it would, because the masks for kids being removed is fairly direct and fairly quick. They will have concerns. And by the way, when we see these kind of news stories all the time, does that mean the entirety of the teachers and the teachers union are like equal in chorus? Fuck this. Yay. Whatever their reaction is? No. People in positions of power in those organizations, some will be like, good, okay, I think this is okay. And others will be going, I'm worried, because what if there's another one right behind this and we get used to not fighting it right about the time Johnny decides to sweep the leg?
Certainly, I hope what this heralds is a more open debate around coronavirus and a more reasoned conversation about the multivalent impact of such a complex new phenomena.
No, they're opening up. They're over it. It's not, we're beyond complexity now. We've vaccinated, at least over here, enough people where the people who are getting it that are ending up in the hospital or dying are intractable anti-vaxxers. And we can't, because we're a free society, put a gun to their head and make them take it. You can limit where they can go, but you can't forcibly make them do it, nor would I suggest you do. And testing mandates have been turned into vaccine mandates in the narrative everywhere because of I don't know who. So society has made ground, made a certain amount of progress, hit basically the gray zone of how much progress you can continue to make or expect, considering the number of people who are like, I'm never getting this vaccine. I'm never getting this disease. Or I'm going to go get it from a friend so I never have to get it. Or I already had it so I don't need to be vaccinated. That crowd they're there. They're just there. They're going to exist. And there is no situation in a free society where you're going to do what they're doing in China, which is effectively box people up and take them away. So, in a complex society with a lot of variables in it, we're reaching that point. Not because the narrative is dying. It's the conversation. No, it's the volume of people vaccinated or who have had it or both. And it's the fact that vaccinated plus Omicron is giving people a lot of resilience in South Africa and other places against any other variant that seems to be popping up. And they think, okay, well, now we'll be able to treat people and it will, the biggest concern was that it would overwhelm the health system, and it's not doing that currently. Even at its maxing out, even at the volumes of death nationwide, they're thinning out across the entire country in a way that it's not overtaxing the hospitals. Like, this is not because some fucking puppet master is running the world from, George Soros's guest room. This is simply reality. And the idea that it isn't like, they really roll it, fuck off.
The censorship around it, and it seems to me, does it to you, that there has been some censorship around it?
No, there's been none. I mean, not in the States anyways. I'm sure he's talking to the States. No, there hasn't. Fuck off. If I got news for you. YouTube, Twitch, Twitter, Facebook, they don't owe me shit. If I say anything that violates their TOS, I'm out. Doesn't stop me from being able to stand on a street corner, say it as loud as I want. I can start my own zine and print copies of it, put it in everybody's mailbox. Can't stop me from doing it. That's not censorship. And if news organizations or social media companies at any point have the federal government messing with them and changing the narrative, in a negative or positive way, in a propagandist way, that if that ever gets out, and it does, it can't not, that'll affect the bottom line of these companies and whether or not people trust them, and it'll ultimately undermine them. The market will speak in that regard. Oh, hi. Love you. Excuse me 1 second. Hi. You look beautiful. That was nice. Do I have lipstick on? I'm good. No, I'm right. Yeah, that's good. Yeah. Thanks. Yeah, sorry. I've got to recover after that. That was lovely. Yeah. Anyways, yes. And it's funny when you can start your own platform. You can move to a bunch of different fucking things. Go on the dark web. On your property, make a giant stone tablet and chip your message into it. You're not being censored. No one owes you a microphone. Meanwhile, this asshole's on YouTube and Rumble, never gets kicked off. It's silly. And, by the way, YouTube, in case you're watching, Russell constantly violates the TOS around vaccines. But I think it's the accent. I think their AI just can't tell.
I don't think is helpful in creating an environment where people with diverse requirements, diverse needs, different concerns, different health histories, different social
shitty vocabularies, right-wing lunatics. No, no one is getting kicked off of any of these sites for being vaccine hesitant because of health problems or concerns. What they're getting kicked off for is asserting that the vaccine has fucking, aborted baby fetus juice in it, or RFID chips, or that it's meant to kill you, it's a depopulation scheme, or that the disease doesn't exist and it was never a big deal and it's just for mental mind control. It's that part of the narrative. That's why you get kicked off. That's true, Karate Joe.
different ethnic and economic backgrounds have to come together as various nations and find a consensus. That surely...
No, they don't. We're not talking about national consensus. You're talking about these three different countries you're talking about, UK, US, and Australia. Interesting, that just formed an alliance against China, and all of a sudden, crackhead Jesus is shit-talking all three of them. Weird, all of a sudden. That's strange. It's odd. So, no, it is not our responsibility, I think, because we do not have the ability to actually respond to a situation where, the nation of Chad or France or whatever is into or against forcing their people to get vaccinated. What the fuck does that have to do with anything? Within your own country, communication on a health emergency is very important. If you want to refine the conversation so that it reaches more people, then talk about that. But that's not what this is. It's like some people just believe that, if you see an asteroid, your cancer goes away. Like, who gives a shit?
Must be our aim going forward. Otherwise, what the bloody hell is a society? What is a civilization if not?
I see. So if North Korea treats their people differently than the West does, then what's the point? I mean, why even have a West?
Care about one another. But what's going on over there in what I assume to be, because I look at the analytics, your country, America, under Joe Biden, who has ceased to publish the daily coronavirus figures. Now, to find this little article, we had to do considerable research.
Oh, yeah. I had to Google for like 2 minutes. What article? Link in the description. Is it down here? Football is nice. He's got a football thing. Facebook, nope. Links. He's on Locals. What a surprise. Subscribe on Luminary. Nope. No link to the article we had to look this up. It's very hard. Let's see. Current COVID stats US. I found them like that. New York Times posts them. They're getting them from somewhere. Let's see. 858,000 dead so far. I mean, I'm sorry, not dead. Impacted. Right, Russell? They've been impacted in various ways. 68 million cases over time, not current. 852 currently. California, Texas. Look at Florida. Look at that. Weird. New York, Illinois. Let's see. Here you go. See, COVID data. The vaccine equity tab shows the national data on booster dose uptake. Hospitalization by vaccine status is also in there. Your community. Oh, weird. So just going to covid.cdc.gov. The Biden administration has stopped posting every fucking thing. Yeah, I can't find anything. Forecasting, vaccinations in the U.S., pandemic vulnerability index, health equity data, pediatric data, pregnancy data, vaccine delivery and coverage in the U.S. states and jurisdictions, vaccine trends, vaccine administered by race, ethnicity, age, and sex, trends in vaccinations, equity again, vaccination among pregnant people, vaccine confidence and coverage estimates, vaccination in dialysis facilities, vaccinations in nursing homes, vaccinations by disability status, COVID-19 vaccinations in there, and then the overall cases. Let's see. Community transmission in the U.S. I don't know where it, like, you can't even find these details at all. I don't know. Fucking hell. Yeah, it's being hidden on the CDC website. Why are they hiding it? What are they hiding? Nothing. Yeah, but why are they hiding nothing? Have you ever been able to look up, like, try Googling nothing and see what comes up? Oh, got you. Shit.
Is interesting. The coronavirus.
Yeah, it's real fucking interesting. Until you go to the CDC's website, the fuck is he talking about?
Deaths and infections and cases is not going to run like a ticker tape across the bottom of your news anymore. Why not? And
because they're divergent. They're no longer linked together because of the transmissibility, but lack of virulence of Omicron, and the sheer fact that the unvaccinated are the primary deaths in this country, and we are tracking, for the most part, people who want to be part of a functioning society, and the people who know that there are people who, say, can't get vaccinated, you know what I mean, and give a shit enough to get vaccinated themselves, so they're not going to pass for example, Delta on to someone for that very reason. Oy.
Was it in the first place? Those are important questions. What?
It wasn't. Asked and answered.
The political dimension to coronavirus and how coronavirus is utilized, because I think you and I would want that the only consideration is how can we help people? How can we take care of people?
Yeah, that's what you're doing, isn't it? That's what he's basically just trying to take care of people. Really. Just taking care of them. That's what I want to hug them. I mean, I'll get vaccinated and mask up when I do it, but if they don't want to, I'll just say no.
Have differing needs and requirements. Some people seem to be very vulnerable, others less so. There are a variety of conditions and
yeah, you don't really need it if you're healthy already. Never mind that bunch of fucking like fitness people and people like I'm healthy as a horse end up on a ventilator and then dead, and like I regret not getting the vaccine before they die. But you know, those are outliers. Because we got vaccinated. Those are outliers. Because we have protections.
Considerations, even outside of health, economic ones, financial ones, social ones, psychological. I mean, there's so much to consider. Are we being honest, authentic, and transparent? The US federal government will no longer require hospitals to report the number of people who die from COVID-19 every day, according to new guidelines from the US Department of Health and Human Services.
Here you go. Hold on. That's what he's talking about. So here we go. U.S. Oh, this is going to be good. U.S. government. Where I can't see the bottom of that thing. Moves to WSWS.org. Moves to end daily COVID. There you go. It'll come up. Yeah, there you go. 6 days ago. The U.S. federal government will no longer require hospitals to report the number of people who die from COVID-19 every day. Not the people who die from COVID-19 every day. They are no longer require hospitals to report the number of people who die from COVID-19 every day. They're doing a weekly trend anyways. according to new guidelines from the U.S. Department of Health and Human Services. On January 6th, HHS published updated guidelines on which information hospitals provide. The agency guidelines note, here we go, we'll look at this real quick in a second. The retirement of fields which are no longer required to be reported, the previous day's COVID-19 deaths. This field has been made inactive for federal data collection. Hospitals no longer need to report those data elements to the federal government. This change goes into effect February 2nd. We dealt with this a while back anyways. Data elements made, and this is in a particular form you send in because they have other ways of tracking all this shit. This is just an elimination of bureaucracy. This is not an elimination of data. The move by the Biden administration to weaken the reporting of COVID-19 deaths has direct precedence in the Trump administration. The House COVID subcommittee's year-end report said Trump administration officials purposefully weakened CDC's coronavirus testing guidance in August 2020 to obscure how rapidly the virus was spreading across the country. Not the same thing. A document issued by Jan 6 by the Health and Human Services tells hospitals they no longer need to report daily COVID deaths to the federal government starting February 2nd. Okay. Here's the document. Templates and technical materials supporting COVID-19 reporting and facts for hospitals, laboratories, and acute care facilities. On March 29th, 2020, Vice President Mike Pence sent a letter to hospital administrations across the country requesting daily data reports on testing capacity and utilization and patient flows to facilitate the public health response to the 2019 novel coronavirus. And Secretary Alex Azar published the guidance for hospital reporting and facts that details must be reported. The updated federal guidance for facilities describing the reporting responsibilities, procedures, and requirements is containing the following fact titled COVID-19 Guidance for Hospital Reporting, Facts for Hospitals. Field changes. Based on this January 6, 2022 update, following changes are needed in reporting. The addition of fields to capture pediatric patient beds and admissions, as well as the inventory and administration of therapeutic D courses. That's the difference. Here it is. That they want how many kids are in there, because that's the thing they have to track to see if these are important or not, because we're just dealing with the unvaccinated now. We know this isn't going to tell us whether or not the vaccines work. This isn't going to tell us, unless it's an obvious spike, which again would be week to week, that people who are vaccinated are dying in mass. And again, 75% of the 36 vaccinated people who died of COVID had four more comorbidities. I can speak. I can say it. Total number of pediatric beds in the facility are current setup, staffed, and able to use. Total number of set up and staffed inpatient pediatric beds. Total number of pediatric ICU beds. Total number of set up, staff, pediatric ICU. This is all the pediatric stuff. And therapeutic D courses on hand administered in the last week. This is to treat children who have COVID. Retirement of fields that are no longer to be reported. Total number of beds for adult patients. It's not useful anyways. You can't use all of them for COVID. Beds aren't all equal. Total number of mechanical ventilators and those in use. There's not a shortage of these anymore. Nobody is trading in them anymore. We don't need to know, it's not important. Emergency department, overflow and ventilated patients. They will know because they have people on the ground. We already send people to these places. Previous days COVID deaths. Previous days current inventory of remdesivir. Critical, because it doesn't work with Omicron. Critical staffing shortage for today and additional details. Level of which PPE supplies are managed. On-hand ventilator supplies, because everybody's got everything. Total inventory and the ability, it's just gacking up detail. Template changes. The goal is to allow facility, states, and IT vendors the ability to use existing templates until they are able to modify to the new format. As fields become mandatory, the prior templates do not include these fields and they will be retired. HHS Unified Template is encouraged when possible, and we would eventually get everyone using this common template that can be used to report any application, any new certifications by states or IT vendors, yada, yada. Okay, this was added to the normal stuff, and we're going back to the normal part of it. So this is the fact. States currently collect this information from the hospitals. Therefore, hospitals may be relieved from reporting them directly to the federal government if they receive a written. That's it. There we go. Here you go. Right here. The states. Hold on. Let me blow this up for you, kids. We're welcome to another chapter, Rusty Trombone, of how dumb this dumb. States get those numbers from hospitals. The states forward that information on to the federal government. The hospital does not have to bypass the state government to send that information. They do not have to duplicate their paperwork and send one version to the state and one version to the federal government. You can just send it to the state. The state will send it to us. That's what this is. We also recognize that many states currently collect this information from the hospitals. Therefore, hospitals may be relieved from reporting directly to the federal government if they receive a written release from the state indicating that the state is certified and will collect the data from the hospitals and take over the hospital's federal reporting responsibilities. If your state doesn't do it or won't certify those findings, if you're in, if you got a Christy Gnomes or you got a, you're in a Carolina and they're bullshitting everyone, then you got to send it to the federal government because the state government isn't going to pass it along. But if you can get that pass from the state because the state actually gives a shit, there you go. This is fucking dumb. This is why the U.S. federal government will no longer require hospitals to report the number of people who died every day. First of all, according to new guidelines, no, it isn't. This is a fucking, that's a lie. It's a lie of omission, and it's a direct lie. They do have to report it to the state, and the state will tell the federal government. They just don't have to do it twice. They got enough shit to do. Ugh. God, this dude is fucking stupid. Russell, you're dumb. Quit it.
On January 6, the HHS published updated guidelines on which information hospitals provide to the agency. The guidelines note that retirement of fields which are no longer required to be reported, among which is previous days COVID-19 deaths. The guidelines note this field has been made inactive for the federal data collection. Hospitals no longer need to report these data elements to the federal government. This change goes into effect on February the 2nd. So that's a change, and a change is a decision, and a decision is based on reasons. What are the reasons? On Friday, Dr. Jorge Caballero, a medical doctor and clinical instructor at Stanford University, wrote, "I'd love to understand why the federal government will no longer require hospitals to report the daily number of COVID-19 deaths."
Oh, I see. He's as dumb as you are. He should read the guidance then. I did. It's linked in the article you're citing, fucko. Jesus Christ.
February the 2nd. The same day the HHS published the update guidance, Dr. Ezekiel Emanuel, a former Biden administration COVID-19 advisor, published an article in the Journal of American Medical Association, JMA, calling on governments to retire the reporting of deaths from COVID-19. Emanuel's call for a new normal was hailed with an editorial of the Washington Post and a lead interview on NBC's Meet the Press, the most prominent.
Yeah, that guy's talking about something totally different. That guy is talking about, no longer tracking it because it's not relevant. It's not relevant to whether or not the vaccines work, whether or not they're getting permeance, whether they're available, whether the treatments are even working, who they're available for. They're trying different things, but everybody who's been vaccinated isn't dying unless they're already, their all systems fail. But that guy's a former member of the team. Maybe he's a former member of the team for the very reason you think so.
The US Sunday talk shows. Commentators responded with outrage. The US government doesn't want us to know how...
Commenters. Commenters? I am real American from Davenport, Iowa, and I would want to know the US government doesn't want to know how many of us are dying. Wrote Chris Richards, a totally real name, in a comment that received 1,500 likes. Well, there you have it. That guy and the doctor that he just cited and Russell, none of them read the fucking document that's attached that is the actual guidance. And then took some other dude thinking, yeah, I don't think we should count them all, count them at all, and mix that in to muddy the waters. Fucking stupid.
of us are dying, wrote Chris Richards in a comment that received 1,500 likes. Thousands of commentators voiced their outrage that after promising to follow the science, the Biden administration has taken an action that smacks of efforts to cover up the pandemic.
No, it doesn't. You're lying. The doctor's either lying or being dumb, and the commenters are just following the slapdash bullshit from WSWS.org, whatever the fuck that site is. What is this? World Socialist website. Global class struggle, pandemic, capitalism and inequality, anti-imperialism, a podcast. They have a Marxist library. And yet, they can't be bothered to actually read any of the documents. Is there a faster way to undermine? Oh, God. Fuck off. It's a Chinese website, dude.
Cover up the pandemic, reframe the consequences of the pandemic and the way that that information has been used. Regardless, the reporting by Caballero and the WSWS stands. On February the...
No, it does not. Back the fuck up. Hold on. What was that again?
Frame the consequences of the pandemic and the way that that information has been used. Regardless, the reporting by Caballero and the WSWS stands. On February the 2nd, hospitals will no longer be required to report COVID-19 deaths directly to the
federal government. And such data will depend on state governments that are themselves moving to shut down reporting. No, according to the fucking document, we just looked at this. If the state certifies it, you don't have to send it to us. If they don't, you have to send it to us. Jesus Christ. Look at this. Look at this right here. Here you go, Russell. To be certified, states must first receive written certifications from their Assistant Secretary of Preparedness Response, regional administrator, affirming that the state has an established, functioning data reporting stream to the federal government that is delivering all of the information shown in the table below at the appropriate daily frequency. States that take over reporting must provide these data, regardless of whether they are seeking immediate federal assistance. States that are certified are listed in healthdata.gov. Oh, good Lord. Oh, we can't get through this fast enough. This is just getting dumb.
Government, and such data will depend on state governments that are themselves moving to shut down reporting. I suppose the question that looms large is, why are these changes being made? Is it to change the perception of coronavirus? Is it to...
No, the data will still be available on the CDC's website. It just comes through it. It's just fucking bureaucracy.
The perception of the impact of it, and what would motivate...
I take it back, Russell. You're right. It's George Soros, Super Jew, and the Pentaveret, and they're all taking over. And we all, how did we all not see this coming? And I do mean not see this coming. And gosh, what are we ever gonna do? The whole thing is yeah. Hold on.
Well, it's a well-known fact, Sonny Jim, that there's a secret society of the five wealthiest people in the world, known as the Pentaveret, who run everything in the world, including the newspapers, and meet tri-annually at a secret country mansion in Colorado known as the Meadows.
So who's in this Pentaveret?
The Queen, the Vatican, the Gettys, the Rothschilds, and Colonel Sanders before he went tits up.
Yeah, that's it. I'm all in, Russell. Preach, brother.
Could it be that Joe Biden is suffering from terrible public perception and is deeply unpopular? Let's have a look. After winning more votes than any presidential candidate in American history, stop it, Biden is...
Oh, I see. I thought he was just an anti-vaxxer. It turns out he's a pro-Trump 2020 truther. Yeah. Hey, has anybody asked Russell Brand whether Obama's Kenyan or not?
Just 12 months.
No, he's not. We've already looked at this. And by the way, I don't know when this article is from, Let's see. Trump polls versus Biden. Let's just throw it in here. So, Biden averaged 48.9% approval, job approvals first. Latest job approval rating 40 was his lowest to date. This is when? January 18th. This is relatively new. Here we go. First year average. So, yeah. See this? See this right here? See this? Here's Biden. That's his average. Here's Trump's. 38.4. What was that again? One of the country's most unpopular presidents, as opposed to the singular most unpopular president. Yeah. So.
One of the country's most unpopular presidents. For months, Biden's approval ratings have languished in the mid to low 40s with an average approval rating of 42%. A Quinnipiac poll released last week found him at a dire 33%. So what?
Yeah, and at the same time, the Fox poll put him at 47%, and Zogby had him at 50%. That's why he averages in the real ones in that year as 48.9. Trump never got above 44. Ever. Fucking knock it off. And by the way, not your country, fuck off.
Seems to me, and these are of course just my intuitive feelings and opinions, is that we are entering a new phase around the corona.
Yeah, which obviously they're intuitive feelings, not based on any facts or information, but sure.
Different attitudes are starting to emerge. I am, of course, still not in an opinion because of my obligations as a broadcaster and my understanding of how the various media I operate within work, at liberty to say what my personal opinions are, and why would you care anyway? But what if...
Well, we know you base them on shit you don't even bother to read. So I don't even know why we would trust your intuitions about things.
Like to me is that we're entering a new phase where politicians are now seeing that there is a requirement to alter regulation and legislation either for
because Soros told them to, or because the fucking disease is changing.
Popularity or different types of political expedients. I suppose at a time where many of us don't trust our leaders, don't trust the media.
And by the way, Russell considers himself a leader.
Trust big business, don't trust big pharma. When we see changes, there is
we just basically live in total distrust. We live in a sea of paranoia, and I don't know where we get that from when we take normal perfunctory governmental bureaucratic changes in paperwork and turn them into a giant conspiracy. I don't know why any of us would be drowning in a sea of paranoia like this.
Of circumspection, consideration, rumination, and even doubt about the intentions. What seems to me to be important is that at a time where some leaders are beleaguered, one because he thinks he's going to be ousted because of a lack of popularity, Biden, one who seems on the edge of being forced to resign.
That's not how our fucking government works, dum-dum. He's in till 2024. That's how it works. Ousted? Jesus.
Of what seems like hypocrisy, and indeed, God, it's difficult to argue with that, are using coronavirus for political ends.
They're ending it, for fuck's sake. That's literally, understand the premise of this piece. I'm over it anyways. We'll move on. The title, COVID no problem now, and then the picture at the front of him and everybody else going, oh no. When in reality, the thumbnail on this was exactly backwards. that Boris Johnson and Biden are probably in a situation where they're like breathing a little deeper about this shit. And Russell's the one going, oh no. Because if they take away this particular, whoopee of paranoia that he gets to suck on all the time, he's got to dream up a whole new way to scare you about, the mind control and the MK Ultra of the governments, and they're all in Agenda 21 is happening. And, the hippie Jesus Glenn Beck, Alex Jones crisscross wannabe. Ugh. All right. Let's move on, because it's the same shit. I had high hopes for this Russell, but you're spending 11 minutes saying the same thing 18 times, and none of it is based on anything. All right. Hi, you're watching Hal Sparks Mega Worldwide. I got to do these things all the way to the bitter end sometimes. And sometimes we just got to bail out, not because the argument is difficult or anything, just because it's fucking repetitive and boorish. Oh my God.